A Pennsylvania addiction medicine doctor works every day to save the lives of her patients.
The three outcomes I usually tell people if they're active in their use is, you're going to get arrested and go to jail, you're going to overdose and die, or you're going to figure this out, get to rehab and figure it out.
How one patient fell through the cracks in treatment continues to haunt her. In this episode of Grieving Out Loud, we have 25-year-old Philip's story through the eyes of his doctor and his mother. Today I am joined by Dr. Aviva Forer and Mother Kate Kimball, who are going to be telling us Phil's story from two different perspectives, that of a mother and that of his doctor. Unfortunately, we lost Phil at the age of 25 in 2019 to overdose. And this story is really unique in the fact that it really shows the gaps in the medical system when it comes to treating addiction and the personal toll this takes not only on family members when someone like this is lost, but also the other people who have tried to help them. So thank you both for being here today.
Thank you for having us.
Kate, I want to start with you as Philip's mom. Tell me a little bit about Philip. And I know you had a long battle trying to help with his addiction.
Philip was a shining star in many ways. He had a beautiful spirit. He loved deeply his family, his friends. And yet he also always had a side of him. I would say that perhaps he couldn't accept perhaps some of his inadequacies. He never liked to do things unless he could do them sort of masterfully from the outset. And in some ways, he was very hard on himself. And at the same time, he was very capable of masking those feelings of self-doubt and shame.
And he was also really an artist musically. I mean, he was gifted young man.
Yes, he was an extremely talented drummer. It was in his corpuscles.
So many parents I talk to who have lost children to addiction, it's the same kind of like story over and over again, where like my daughter was an artist, your son was a musician. They're very, left-brained, they're very creative and sensitive souls, don't you think?
He was extremely so. You wouldn't know that perhaps off the bat. Aviva, I know you can speak to that. He had a bravado. But there were times, through this struggle that he would call me in just such despair. And it was very difficult for him to accept the fact that friends were, sort of moving on in more typical ways. He went to college for a year and decided he didn't want to go back. He never enjoyed school at all. And I remember one call just talking to him about the fact that he's basically needs to subtract 10 years from his age. And
because he started using substances. At what age did he start using?
Well, I believe around 13. Right. Or so. I think he started smoking marijuana. And I, expressed to him that there was no shame. It just was what it was. And so figure you're more developmentally, where you are in your life, more 15. But he just couldn't ever gain traction. He had successes as a musician, as in sales, managed a store, and he would just sabotage over and over and over again. And he just never could stick with anything.
Oh. And Dr. Aviva, how did you come to know Philip then?
So he came to see me into February of 2016. I believe he was 21 years old.
Because he withdrew one weekend. He went through withdrawal. And I remember, making frantic phone calls and reached somebody, who put me in touch with you. And then you saw him like that Monday, I remember, right after.
And
Right.
I should mention, Dr. Aviva, that you're a family practice doctor, but you also specialize in addiction medicine.
I actually, Angela, I look at myself the other way. I'm actually I'm an addiction medicine specialist who happens to also be family medicine.
Yeah,
I practice only addiction.
Only addiction. Okay. There's not enough of you out there. I can tell you that right now. So you met Philip and he was about 21 and he died at 25. So was there anything different about Philip? I know you work with a lot of patients who suffer from substance use disorder.
Yeah. I like to say that everybody has their own unique story and their own unique things that brings them to see me. But he really was a fairly remarkable young man. Kate was right. There was something about him. He was striking looking. He had this kind of cool, casual on the outside demeanor. And, as a mom, I could see like the child inside of him, that like hurt child that he would let me get glimpses of every once in a while. And he was amazing. His saying, which he would say over and over, was just keep it moving. I'm just going to keep it moving, doc. And that he would say that to me so often that I found myself using it sometimes, like, all right, we just got to keep this, you just got to keep it moving. There was some pretty remarkable things about him.
I think that we're all looking for answers, right? I mean, Kate and I lost our children. We can't bring them back. I would assume that you agree with me, Kate. Like, I don't want any other family to go through what we've been through or to lose, a beautiful child. Philip was your oldest. Emily was my oldest. And yet saving them, I mean, that's your job, right, Dr. Aviva? That's your job. But it's so complicated and so hard to do. What do you think the limitations are right now for doctors and for people in this field?
So I see my role as not so much as saving them as helping them find their own path. It's a blessing that I get to do what I do. I love it. And I feel honored to be part of these people's lives that come in to see me. I recognize that it sometimes is the first time that they've opened up about things, and that vulnerability and trust that they place in me. I wish that the rest of the medical community could sometimes see people who struggle with substance use disorder the same way I do. So that would be the first barrier, I would think.
How do they need to see them? I mean, what needs to change in people's minds and hearts?
Yeah. What needs to change is if you walk out your door and go down the street and look at the people that you pass, if you go in the supermarket and look at the people that you're walking by, if you go to your child's PTA meetings and you see the parents of the kids that are around you, that you start recognizing that a percentage of those people are struggling with substance use disorder. That most of the people that come to see me are people who have jobs, who have kids, who go on vacation, who have nice cars, who have these silent, who are incredibly attractive and talented and went to good schools, and that they are also walking and talking and interacting with the rest of us.
And had parents who loved them. I mean, I think
that's a great point. Love them and were there for them and gave them all the opportunities.
I have to tell you that as someone who is in the public eye and who reports on things that can be controversial, people don't always like all of my news reporting, and they don't agree or they want to take issue with it. And I'm an easy target now because I went public with my daughter's death. And it's very hard to take when somebody tries to use that against me and say, oh, well, you've got a problem. Your daughter died, of overdose. You're the problem. How dare you report on this person's death, or how dare you do anything that you do because you're lacking as a human being. And I don't know, Kate or Dr. Aviva, if you found that to be true. Parents especially feel so responsible for a child who ends up in addiction, in the throes of addiction.
I think, yes, I think as a parent, it's sort of impossible to avoid, some of those feelings. I think by and large, I mean, we for many years, we intervened in so many different ways on his behalf. And I truly believe, I don't think I could have done much more, except I do wish I had been more open about it. After he died, I became 100% open about his addiction. But as a parent struggling with a child, I didn't want to face what you're talking about. It's exactly what I avoided. And I do wonder, Gia, if I had been more open, if I had let more people know, would that have shifted the outcome? That's my primary regret, that I let that, the stigma and the shame get the best of me.
Well, hopefully by us talking about it now the way that we are, it's changing that in our culture maybe a little bit. I mean, not to the extent we all want to see it and as quickly as we all want to see it, but really, Dr. Aviva, you were the first one to get Philip into inpatient treatment. Is that correct?
That's correct. Yes.
How did that happen?
So he'd been seeing me for 4 or 5 years, had kind of relapsed a couple of times. Most notably, once was at work. It was a pretty dramatic seizure that he had that was caught on the CCTV and at work, and was pretty traumatic for him, for his father, for his mother, and for me. And it was a real wake-up call. And even that wasn't enough to kind of help him get back on track. And I look at addiction and recovery as a continuum of care. It's not an on-off switch. You're not cured and done with it or in the throes of it. It's where are you on that continuum? And part of that continuum is residential treatment or inpatient treatment. And that's one part of it that he hadn't tried yet. And we hadn't tried yet. And he was pretty resistant to it. And he had come to see me, and I knew he had been using. I could tell by just the changes, as I'm sure both of you.
And I think you also got a message from his dad, perhaps, that he
had relapsed,
or that he recognized that Philip was taking things to sell.
Oh, correct, right. So his father reached out to me and said he had taken some things, which also is kind of clear that he's looking for money. But it kind of culminated in both Kate and his dad and Philip coming to my office and me wanting to sit down and talk to him and kind of confront him. And I'm not a real hard line, tough love doc. That's not how I usually work with my people. And I don't find that works. But with him, it became a matter of life and death, especially because one of the substances he used when he would relapse was benzodiazepines, and they could be really dangerous. If you stop them suddenly, they could cause seizures and death. We had this culmination of a session in the office where he stormed out the window, and I'm actually sitting in the office looking out the window right now. And I pulled up the window and yelled at him in the parking lot, which I've never done.
And before. We were there. There was sort of like a planned intervention.
I
remember.
Yeah. Yeah.
Right.
And so
he was in the waiting room.
And he had a response, I think, that many people who are suffering from this have. And it's like, well, you're not going to take this away from me. No, I'm out of here. Absolutely not. Right. I mean, isn't that typical?
Yeah. And he said, I'm here on my own willingly. And I don't have to listen to this. And he walked out the door, and I probably used a little more colorful language than I would like to admit. I remember he yelled back at me what kind of doctor does that? And in my head, I'm like, I really felt like I'm not a doctor. I'm a mom right now. I need to help you stay alive. I mean, I just felt that drive, and it culminated with his father, and he went into his dad's car, and we talked, and I told his dad pretty much you need to make a decision. He was living with his father at the time. And I said, you either need to kick him out or tell him he needs to go to residential, because this is not going to end well. And the 3 outcomes I usually tell people if they're active in their use is, you're going to get arrested and go to jail. You're going to overdose and die, or you're going to figure this out, get to rehab and figure it out. His father did kick him out, and he was gone, I think, for a day. He went overnight. Yeah.
So he left sometime Sunday early evening or something, and at 4 a.m, he was knocking on Art's door, and he was just sitting on the front porch he was cold, and he didn't get very far, and said that he would go to rehab.
And everybody just wants to breathe a sigh of relief, right? Like when they're going to rehab. Oh, this is going to do the trick. But you encountered, Dr. Aviva, a lot of obstacles after he went into rehab, right?
Correct. And I want to clarify. So going into rehab and detox is such a critical part of recovery. And back to your question earlier, another myth that I would like to clear up or to educate people about is it is a part that's critical, but it's really important to realize that that's not complete treatment for addiction. And it's, a critical step, but not at all the end all be all. And people aren't finished when they leave 30 days.
Yeah.
And so, yes, I sent him, I got in touch with the liaison and sent him to a local place. And then we started encountering the first of problems, which was insurance coverage. So he didn't have insurance coverage for the local rehab, which is right near us here in Philadelphia. So they had to look for a place that took his insurance.
Yeah, this is a huge problem with addiction, especially anybody can hang up a shingle and say they're in addiction treatments, and there's not a lot of regulation of that throughout the country. And then it's historically been treated outside of the medical system, and you don't have doctors always screening for it. And then there's the insurance issue, like insurance won't pay, or they'll pay very little, or they'll pay for just a short amount of time.
They didn't cover 30 days.
Right. And Angela,
like
I was
20,
actually
closer to 21. Maybe.
I think he was there for 21. And Angela, what I want to say is actually 30 days is a completely arbitrary number,
right.
which has been created and dictated only by the insurance companies. The data shows that most people need 60 to 90 days of intensive inpatient treatment to really get their feet on the ground.
How do we change that in this country? How do we do that?
Scream louder. More of I think more people need to be touched by it. I think more awareness.
We have 194 people dying, every day. And you sure would think we would want, if we can figure out how to, come up with a coronavirus vaccine, and I understand that the impact is even greater. We don't blame the coronavirus patient for, catching it. As we do, the person suffering from substance use disorder, usually we blame the individual or their family or somebody, other than we don't want to recognize it as a disease. And I just think we have to do better. We have to do better. We're losing a generation of young people, and not just, these are not people who are like scum of the earth or whatever. These are brilliant people that we are losing all of that human potential. And it just infuriates me and frustrates me. And I don't know how we get that change to happen.
So I think that's a great point. It's interesting. I grew up around here. I went to the same high school Phil went to. I have a 15-year-old who's in 10th grade who goes to the same high school. And we were talking about this in the car earlier, just, addiction and all of that. And I said to her, by the time you graduate and get into college, a certain percentage of your classmates will have died and overdosed. And I think back at my experience in the same high school, and I did not know anyone who overdosed and died. And you absolutely hit the nail on the head. Is this entire generation has become decimated and numbed to the fact that their peers are dying and they're going to more funerals than they are weddings.
Here's an interesting story. My middle son went also to the same high school, and one of the kids had died from, I don't remember if it was cancer or had been hit by a car or something. It was a tragic loss, and I don't remember if it was a he or she, but there were sort of announcements. It was a public death that allowed for kids to grieve publicly in the school, et cetera, et cetera. Not too long after that, another boy had died from overdose. Silence.
Yeah, well, that goes back to the stigma, right?
Yes,
perpetuating.
It's not worthy of acknowledgement because it was addiction.
That's devastating. So 21 days, Philip had 21 days in this treatment center. And how did things go, Kate, from your perspective?
Poorly. It was very difficult to get, initially when Philip went in, he wouldn't give permission, I think, for anyone except for maybe his dad, right? Because of HIPAA, as though he was in the right frame of mind to make that decision. So I wasn't able to speak. I could speak to his counselor, but she couldn't really give me any information. And the level of sophistication regarding her and her understanding of him, of addiction, it was kind of a little shabby, I would say.
So maybe
it's
the
a little frustrating.
care, maybe the quality of care that you would have for.
Perhaps, yes. And one of the first questions I had, have you been in touch with Dr. Four? No, I'm trying. And I don't remember exactly how long it took, but it took a while because Philip wouldn't give permission. I mean, what kind of collaborative care is that?
I mean, didn't you refer him?
So that's the interesting thing. You're right. And this is not the first time that it's happened to me, is that as the referring physician, I have a relationship with many of these kind of clinical liaisons where I say, hey, I'm going to send somebody to you. They need to go in ASAP. And then they'll do the connection. So they know me. They know of my practice. Yes, I was the referring physician. I sent them there. Indeed, sometimes clients can be really angry or impaired or both, and they don't want to put me on that. But there is no, there needs to be more communication. As the physician who's been prescribing medications, if they pull up the physician drug monitoring program, they can see that I've been prescribing all of his medications. As the person that sent them there should be some kind of communication with me. So that was issue number one.
Right. And then to sort of make an assumption that the patient's decision who has contact and who doesn't is based on anything all that rational. I mean, they're not usually in a very great state of mind.
Right. It's a disease of the brain. I mean, it's a disease of the brain. And, but I mean, how these HIPAA laws and everything, but it seems to me like where does common sense come in to some of this, right?
Yeah. And so any communication, it just always felt, and I blocked some of it, I suppose. It was not a great experience, but the staff just never seemed to have it didn't feel like there was much cohesion between among staff members. And Philip, once I was granted permission to speak with him, was just angry and griping about how poorly it was run, and he would always hone in on any system's weak links. He was very, very good at that. And so I've sort of learned over the years too to sort of, not quite take it with a grain of salt, but also to recognize that he's angry and he needs to sort of target that anger onto the system. But he was actually completely accurate in his assessment. But so in terms of the care itself, it wasn't very good. The discharge planning was disastrous. I did have
I want to talk about that for a minute, because it is really like you get someone into treatment and they're in there, right? They can leave at their own free will, but let's say they last 20 days or 30 days or however long. Really the key to keeping them healthy and alive is the discharge, right?
Right. And so if I can jump in just for the middle part. So in a well-run system, the way it should be, as any other chronic medical condition, is you would expect that you would have some coordination with the person that sent the person there. During the course of treatment, you would have some coordination and communication with that same physician, because I'm the one that knows him best. And to get some input on what I feel is appropriate, treatment, not treatment, and then discharge. So even during the treatment, the detox process, there wasn't a lot of communication, because one of the tenets of really good treatment and recovery is medication-assisted therapy, MAT. And that's prevent cravings, but also to block people from using, because really the most fragile time people frequently have, surprisingly, is like right when they get out of this, treatment of inpatient, and they've not taken any substances for 3 weeks, 4 weeks, 5 weeks. They've lost all their tolerance, but in their brain, which is still active, really in addiction, they think they still have the same ability to use that they used before. And if they go out and use, they will frequently overdose. So that is almost more critical, is to get them set up while they're in there so that the coordination is there when they get out, that safety net.
Right. And
it was really clear that he needed, sort of intensive outpatient, 5 day a week, 6-8 hour a day program, which was what was recommended. And guess what? Insurance wouldn't cover it. Insurance covered 3-day a week, like 2 hours per.
Right. So levels,
yeah.
So levels of care would be inpatient, which is living there, staying there. Then what you're referring to, Kate, would be PHP, which is partial hospitalization, which is 5. Right. So PHP is 5 days a week. It's about 6 hours. And that's much more intensive than being at home. That would be the next level. And then an IOP would be the next level down, which is usually 3 times a week for about an hour and a half. So it goes for hours of treatment face to face. And then OP or outpatient is the level of care that I do.
And what happened to Philip after he got out of the treatment center?
So I didn't even know he got out. Let's start with that. Back to no communication. I didn't know.
You were actually at a conference on heroin?
So I went away I went to a summit in Atlanta, heroin, an opiate summit, and met some really wonderful women. And it was during that time that Kate called me and let me know that he had overdosed and died.
And you were under the impression he was still inpatient.
Yeah, I really was. I thought he was still there. And so not only did I not know what was going on with him, I didn't know that they discharged him. I didn't know anything.
And I think he opted not to stay on Suboxone or something, medication like that, I believe. And I think they let him make that decision. And they did not include you in that decision or us. Mm-hmm. It was bad. It was just bad.
Let down by the system in every way, right?
In every way. I mean, in every way. And really I've said this before, like if you were to show up in an ER with chest pain, any one of us in any ER in the United States, there's really clear protocols in place. If you were to show up with, with COVID symptoms, really clear protocols. And very early on with Corona, there were very clear protocols in place for what to do. We've been struggling with addiction and substance use disorder and opiate use in this country for how many years? And still there's no clear protocols about what to discharge a patient on, to make sure that a provider is set up for them that's going to maintain the medications, to make sure that family members are aware. There isn't. It's so varied.
I know. I can't believe the number of people I've talked to in my community who've overdosed, been taken to the emergency room, were revived by Narcan, and then just let out of the emergency room. Never talked to, never given any sort of course of treatment. I mean, this happens all the time. And so how can we expect these people to recover or live?
The system's against them.
Right. And if you think about it this way, Angela, if you develop diabetes and your pancreas is no longer creating insulin, even if you're overweight, you smoke, you don't exercise, all these other behavioral things that you have choice for, no doctor is going to say to you, well, it's kind of your fault you've got the diabetes and you're just going to have to figure this out. Yet with substance use disorder, yes, they make bad choices. Most definitely people do some really not good things for themselves. But the basis of it is their brain is not functioning correctly. They've actually rewired their brain. How do we treat those two things so differently when they're not?
Right. I use that analogy all the time when I speak, and sometimes people get angry when I use that analogy, but I say, I'm talking about the kind of diabetes that's caused by lifestyle, choices. Mm-hmm. And I think it's so accurate. And I just think the first time someone chooses to use a substance, that's a choice. The first maybe 1 or 2 times, but for a great number of people after that, it no longer becomes a choice. It depends on if you have that addictive gene or I don't know, environment, genes, all of those things combined.
3. It's environment. It's exactly correct. It's environment, it's genes, and it's your hardwiring. So
Philip had certainly the hardwiring, and he had 2 paternal uncles who died of addiction.
Oh, yeah. I think those of us, we certainly on Emily's side of the family, but they've been, on my side and her dad's side, addiction in both. So,
and we don't know who's going to be the person that does that.
I wish
Philip
we could
also
pinpoint
has 2
it, right?
siblings. Right. So you don't know. So is part of it the kids he hung out with? Is part of it his wiring? Was he exposed to some kind of situation that just changed the way his brain was,
trauma,
that nobody had control.
Yeah,
but nobody had control over, we knew about. Like
his birth was very traumatic. I go back to that.
Well, so was Emily's. So was Emily's. I was in labor for 37 hours and it was a very traumatic birth. Yeah.
Same.
Isn't that interesting?
I thought he was dead on delivery. It was an emergency C-section. And it was just bad. Everything that could go wrong did.
I'm so sorry about Phil's loss, Kate, and you too, Dr. Aviva. I mean, to lose a patient like this, I know you haven't lost very many patients, so you've been fortunate, in that way, working in this field. What lessons do you think we can learn, as a society from what happened in Philip's case?
I mean, from my perspective is to never make assumptions about who a person is or what they've gone through when you find out that they're struggling with substance use disorder. I'm seeing more and more of that right now. COVID has definitely affected people, and especially with alcohol use, a lot of people that maybe managed to be functional and carry through life and work and family obligations pre-corona. Now it's sort of brought things to the surface with more people being at home, being able to kind of navigate drinking and work. So not to make assumptions. The other one is that we need to advocate more for treatment and for education about it. I'm passionate about education. I really believe that we need to start education when children are young. We need to educate in high school. We need to educate in medical school and certainly in residencies, what substance use looks like. Not everybody has to do what I do and go into addiction medicine full time. Almost any specialty you go into, they're going to overlap with people who struggle with substance use disorder. And how do they navigate that with compassion and kindness? That would be the other thing. And I think we just need to put more money into treatment. It's woefully lacking. There is no reason why someone who is part of our system and wants to get treatment has to be shuffled back and forth and not even have a full 30-day stay because of the woeful shortcomings of the insurance companies and what they're willing to pay for. Like you said, it is an entire generation. He is such a great example of an entire generation that's falling into the cracks, not being able to get treatment that they need.
Yeah, and it's so hard. We provide, my charity, Emily's Hope, we provide treatment scholarships, but they're partial treatment scholarships. We're trying to help as many people as possible, and it's so expensive. I mean, it's such a deterrent. I mean, Kate, can you tell me how this whole experience has changed you as a person, knowing Philip's death? How has that changed you?
I'm sad a lot, for sure. I feel like I have a new filter, an internal filter, so that my experience of the world in any given second, even if it's not conscious, it's filtered through that loss. And I am definitely more open, less likely to judge myself, judge others. It's interesting. I value life. I value the life of my other kids. I feel like, though, as a parent losing a child, I don't want this to sound the way I'm afraid it might, but I'm just going to say it anyway. I place less value on my own life. I mean, I'm not looking to die. I'm not doing anything. I'm not suicidal, but it just feels less significant or valuable or something. Losing a child is, I mean, it's interesting. I would think about this because it wasn't a huge surprise. I don't want to minimize, but I had often thought of Philip dying, and I imagined that I would just never get out from under the covers again. It wasn't that way. I mean, I had a couple of days like that, but I'm amazed, at the same time I place sort of less value, I also am amazed by there is a life force. And I step back and think about it, and it's like, wow, I went back to work in 10 days, and I stayed open with people. I got out of bed. I functioned. I, did what I needed to do for my other kids. So I recognize there's a strength that I have. But also there's an incredible sense of isolation, and not just because of COVID, that certainly doesn't help. But I recognize that in most situations, I feel different.
Yeah.
The only place I really don't feel different is in a bereavement group, a parent bereavement group that I'm a part of, that its members are parents of kids who have either overdosed or who killed themselves. And in those moments, I feel just like everybody else in that group. And it's like I can breathe freely and I don't feel different.
Yeah. The human condition is to long for belonging, right? And we really are outsiders as parents who've lost children to overdose. Most parents, thankfully, or more parents experience it now than at any time ever before, but most parents don't experience that. So we are outsiders. And I think there's also contradiction in loss and grief, right? There's that contradiction you're talking about, where you think, well, maybe you should just be under the covers and never being able to, do anything again. But at the same time, you find something inside of you that like in my case, I want to do this, what I'm doing right now, So there's the brokenness and the openness, I think, in grief.
Yes. And I'm also aware that some people will say, oh, I can't wait to stop feeling this way. And I don't experience that. I'm afraid to not feel this way because this is the only way I can connect with my son. And I can't, I don't think about happy memories. And, they don't put a smile on my face. I mean, my connection to Philip is through my grief. And I'm certainly not ready, at any rate, to let go of that.
Well, I don't know that we have much of a choice, really, quite frankly. I think that maybe the intensity of the pain lessens, but I think that we will always be grieving our lost children.
Absolutely. But it's actually, it's the intensity of feeling it. It connects me to him. And I'm not, crying every day anymore, and I function and I can laugh and make silly jokes and whatnot. But I miss him there's just no words to express the level of pain in that missing. It's bigger than anything I could imagine. And yet it's like, I don't know, living in front of a tsunami every day or something. It's so big. And yet we walk with it all the time.
Right. We carry it, and you never know when that tsunami might knock you off your feet at any time. And that happens in grief, but somehow we carry it. And I just want to commend you for talking today, about what happened and about Phil. And that takes courage too. And Dr. Aviva, I just wondered if there's any thoughts that you wanted to leave us with as well.
My biggest wish would be for our society, as a whole, and then down to like our communities, our neighborhoods, our families, and the individuals to really see substance use disorder for what it is and recognize all the different aspects of it. Seeing both of you and hearing both of you talk about your losses and your children, and to recognize that this isn't something that happens to people different than me, and this isn't something that can't ever happen to me, and that it can touch all of us, and how universal that is. It's people who struggle with substance use disorder have much more in common with each other and with others than we realize. And that to me is like the biggest. I have students in here all the time. I have nurse practitioner students and medical students and residents who rotate, and doesn't matter what field they're going into. And I do it because I want to open up people's eyes. And that is something I get back all the time, is like, oh my God. And hearing the way I talk to them and hearing like, the conversations we have, they're always surprised by what it is when they think about what addiction medicine is and what it looks like and what addicts look like. It's so different when then you come down and sit and talk to somebody.
Yeah. Well, they look like Emily and Phil and
exactly
millions of other people, right?
And me and you.
Yeah.
That's the point.
Yeah.
They look like all of us.
And there's so much collateral damage in these losses. That's what I think about a lot lately. It's not just just my grief, but my children's, and, Emily's stepdad and her father, and your grief is that you're a human being. I mean, I understand your role a little bit, because as a journalist, when I'm covering stories and talking to other people about their stories, there's always this separation, right? And as you try to maintain that professionalism, but we're still human beings. And I know you do that as a doctor, but you love Phil too.
I'll be honest with you. I've said this to patients frequently. Sometimes they'll say, well, I'm paying you and this is your job and I'm paying you to do this. And that's true. This is my job and I do get paid for this.
That's what he said to you.
Yeah. And what I said back is, you don't pay me to care. I care. And that, people intuitively know that. They know when you care. And that's something that I give and do freely and lovingly. I mean, I do.
Well, I'm just thinking about Phil. I've told you this, Philip. I mean, we had a good relationship, all things considered, and he would share things with me. And, he would tell me about a session he had, and he would just say, like, go
ahead.
Fucking Dr. Four, fucking blah, blah. She blah, 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 blah. And he would bitch about
it. Kept coming back.
And then, like, the next week, oh, man, she is awesome. She's the best. Which is, how he felt about me too. It's like he was black or white.
Right. And Emily was very much that way too. She'd either, whatever. She's angry at me because I was trying to intervene with her use, and
right.
Yeah.
But I want to say too, to come back full circle, it was so meaningful and is so meaningful to know and to hear from Aviva how much Philip meant to her, and that she could share that with me and her sadness with me. It honors him in a way, and it speaks volumes to the work that she does. And yes, we need more of you.
Definitely.
And that, she was at the service and stayed in touch, and I gave her one of Phil's t-shirts, and
which I wear.
Oh,
I do. I wear. It's like my come home and get comfy shirt. I have a couple. Oh. I wear it all the time.
He thanks you.
No, it's true. I mean, it's we started this conversation talking about coincidences. I really don't believe in them, but I do. I think we're touched by people in our lives, and sometimes we don't know what lessons we're going to take. And I mention him. I don't say who he is, but here in sessions, I'll say, listen, I've lost people and they've fallen through the cracks and they've ended up, not here anymore. And I don't want that to happen to you. I mean, I will, that loss also fuels me,
yes.
to hopefully help one other life and one other mom not have to lose her son or daughter.
And in another lesson to be learned too, I never heard, the facility knew that Philip died, and I never heard boo from them. And that was very painful. Oh. It just as though he was just, patient ID 82453 or something like that,
right.
Never heard from him and that I have not resolved that.
I'm
anger.
Sorry. I'm sorry to hear that, because even the facility we were going to bring Emily to, we were planning this intervention, and I had, cleared the insurance, and they had a bed for her, and she didn't know, what we were doing. The people from that facility came to Emily's funeral. So I had an opposite kind of experience than you. And I'm sorry that, he's someone's son and someone's brother. And I mean,
I still, sort of fantasize about making a phone call, and I haven't done it.
But as a facility, that this is their job, I don't refer to them anymore.
Oh, you don't?
No.
I mean, if we have an animal that dies, we hear from the animal hospital.
Sure.
They send a car. They're kinder at the animal hospital and more empathic.
What would be the best thing that could happen is that this facility would change some of its practices in light of what happened with Phil.
To tie that up, they were supposed to, and they put me in, because I did a real deep dive dissecting how this happened and spent a lot of time and energy trying to track down and get copies of notes and all of that. It was incredibly frustrating. I even talked to somebody pretty high up, and at the end they were going to establish protocols, and they asked me if I wanted to be part of it. And I heard nothing after that. And
Oh,
and to me, that is such an absolute lack of back to compassion and caring. It's a business and they do really well. And I'm glad for them. They fill a niche on that continuum of care. That is important. But to me, like that shows there's no care in that continuum. And that, I mean, that's where I can't be part of that. You know, I refuse to be part of that. Yeah.
I just want to thank both of you for joining me today and for sharing Phil with us and for our audience. And if nothing else, I'm just privileged to have met both of you. And we all have a
Likewise.
similar mission and share so much in common. And I just want to thank you for your openness today.
Thank you so much for having us.
Thank you.
Thank you.
Thank you for listening to this latest episode of Grieving Out Loud. For resources for families and how to get help, just go to emily'shope.foundation. If you're enjoying this podcast, please consider leaving a positive review. Thank you.